Joining us now on the program is Christina Harvey, the health curriculum consultant for our first Oakland Schools Education Insider, which will be happening bi-weekly here on the Megacast on Thursdays late in the program with our friends at Oakland Schools. Christina, thanks for being with us.
Thank you for having me.
Appreciate having you on. First off, just give us a little bit of background information about your role with Oakland Schools and some of the things that you work on from day to day.
Yeah, so I work to support our districts in providing quality health education for our students. So that looks like consulting with our districts around what it is they're currently offering, how they might be able to make those classes more engaging and relevant, and then also maybe developing resources or training for them. I'm also our school health coordinator for the Michigan School Health Coordinators Association. So I represent our region as one of 24 sites across the state that have expertise in supporting our young people's well-being when it comes to school systems.
And there's a lot that goes on in the background at Oakland Schools to be able to make all these different things happen, to be able to develop these programs, execute these programs, and look into how they are working over the course of time so that they can have the goal effect on the students, but also can be modified to have an even greater effect. So with that, some of the different efforts that are made include something that happened late last year in December. Oakland Schools hosting its K-12 Live Well, Lead Well Summit, focusing on overall well-being of students, staff, and communities. Can you give us an overview of what happened at this event and some of the professional development that was undergone by Oakland School staff?
Yeah, so this summit was actually planned by 5 of our educational service agencies in the area. So not just Oakland Schools, but also representing Wayne, Macomb, Genesee, and St. Clair counties. Our superintendents were involved, as well as the other school health coordinators. So job alikes to myself were a part of this. And our goal was to really start the day out with a call to action. What are youth experiencing when it comes to well-being? How can we respond to what it is that's going on with their mental health and their overall well-being? So what programs or practices are shown to work within our schools? And also what kinds of resources or partnerships are available locally to support them in doing that work right now? And then we wanted to give space for those that came to the summit to actually be able to plan. So how do I use this information to move forward my work?
And this was a collaboration not just within school districts overseen by Oakland Schools or in partnership with Oakland Schools, but others in the nearby area too. I understand from the notes from my notes that 5 different counties actually were participating in this summit.
Yeah, we did have 5 different counties. So on the day that everyone came in, we had around 450 people that were participating with us from all 5 of those counties. We had asked for teams of staff from those districts that lead health initiatives to come in for this session. So think of leaders like the superintendents, principals, mental health professionals, school nurses. We had a wide range of individuals from buildings that came. We also brought in leaders not only from our educational service agencies like Oakland Schools, but also the Michigan Department of Education and community partners like our community mental health or school-based health centers from all 5 of those counties as well.
And this is something that has become more of a focus in recent years for not just Oakland Schools, but other ISDs and individual school districts too, is focusing on student mental health. It had been previously because of just a lack of a focus on it, maybe the stigma being greater behind mental health issues, especially for kids, that these things weren't focused on. But another key factor was just schools didn't have the resources available to them in their individual districts or through their ISDs or other avenues to be able to access some of these programs and some of this information to enact these programs. So recently, the legislature and the governor passed a historic budget that puts a lot more of an investment in our students and in our schools. How do you envision that this new budget and kind of that renewed focus in education and education funding may impact the ability for school districts and for ISDs like Oakland Schools to be able to focus and make an impact on students' mental health?
Yeah, I'm really hopeful that it presents an opportunity for our districts to build that solid foundation, to secure the staff that they need, the services and supports that the research shows us are needed for youth to be healthy and to support their well-being, especially when it comes to their mental health. This might look like hiring mental health professionals and school nurses at best practice caseloads for the number of students that we have within a building.
And so, following the summit in December, the K 12 Live Well, Lead Well summit that included schools from 5 different counties and certainly had heavy involvement from Oakland schools. What steps have been taken since then, or maybe even already are in motion through Oakland schools to kind of take what was learned on that day from all that collaboration and now put it into action?
Yeah, so the five agencies that worked on pulling this together, those school health coordinators have still been meeting in order to better understand, what are districts reaching out to each of us about? How are we individually supporting them? And also, if it's appropriate or helpful for us to do something regionally again, that we're ready to do so quickly. And then at Oakland Schools, what we're getting ready to do is actually launch our Whole Child Collaborative webpage. And we're really hopeful that this collaborative branding will make it easier for our districts to access and find our services that support youth well-being.
And how is Oakland Schools then providing support to these local school districts? Because you can make all these plans and it can provide all these different suggestions for individual school districts, but some of them need additional help from their ISD or just need the guidance to get these programs sort of rolling and tailor them then to their individual student bodies.
Absolutely. So we are fortunate that in the last year, we actually did an inventory of what is it that we at Oakland Schools offer. So right now, we know that we offer around 50 different evidence-based programs and practices that help schools build those quality systems. And with those programs and practices, we reach a variety of ages and grade levels from pre-K all the way up through transition programs. We touch on a variety of health topics, so not just mental health, but also thinking about areas like nutrition, social emotional health as well. And then we also offer those across a scope. So, what we often call tiers, which is really about the intensity of the support that we offer. So, some of our services are lower intensity, meaning that we offer them to every student within our building. Think like a health education class or the lunchroom where you go to get lunch. Also, some are of higher intensity. So, fewer students need more in-depth support in order to be successful. And so we have, supports that go across that range. One specific initiative that I can share some details with you about falls into that category of all of our students would receive it. It's called our Oakland County Here for You project. And that project is really about youth voice and leadership. We go and train teams of high school students to be able to create campaigns in their buildings that increase awareness around mental well-being, decrease stigma around depression, anxiety, and help seeking behaviors, and then also work to connect their peers to trusted adults and local mental health supports.
We're joined on the program today by Christina Harvey with Oakland Schools, their health curriculum consultant. Joining us on today's program to search for Oakland Schools or go through your local school district and their link to Oakland Schools to find more information on various programs and resources available through your local ISD at Oakland Schools as well. And as we're putting these programs into practice, just what sort of impact is either projected or has been found through studies of just how much working with students on their mental health and focusing on student mental health can actually be very beneficial both in the hallways of the schools but also in the classroom and ultimately at home for a variety of different students.
Yeah, so we have a lot of research to support that overall, healthy students are better learners. We have data that's back a couple of decades from agencies like the CDC or Centers for Disease Control that really do show us that when our students are engaging in healthier behaviors and less risky behaviors, that their academics improve. They're also more likely to be connected to social support. So, having positive relationships with their families, with others in their community, and within their schools.
And these aren't just things, Christina, that need to be focused on and need to be worked on in school or in the classroom with these students. These are things too that both the students and their parents and their families should be focusing on at home. What suggestions does Oakland Schools have, or do these sorts of programs have directing to the families to also do their part in addressing mental health in their homes and ultimately helping their students all throughout their life?
Yeah, it's really important that we involve all stakeholders. So, schools have a role to play as well as our community agencies and our families. And so we really want to make sure that families and communities are aware what kind of education is happening within the classroom to be able to continue those conversations, build deeper, and, reinforce those kind of healthy skill building at home. So I think it's really important for all of our stakeholders to be on the same page in terms of supporting well-being.
You can learn more information about programs through Oakland Schools by visiting their website at oakland.k12.mi.us, oakland.k12.mi.us, or call them 248-209-2000, 248-209-2000 for more information. Going back into the Live Well, Lead Well Summit, you had the privilege of presenting at that summit as well and be able to provide some of this information to different educators and others that are stakeholders in these communities throughout southeastern Michigan. What did you present on? What really was the message that you were providing to the audience on that day?
Yeah, so I think it's important to remember districts or school districts are big systems. There's lots of people, lots of students, and a variety of roles there. So, some of the reminders that we gave during that summit that day were that this work takes time. We need to utilize a diverse team. We want to have individuals on those teams making decisions that work directly with students of various ages that have various needs, and that our roles with interacting with them are also, serving a variety of purposes. So that way we can think of the most collaborative, holistic responses for our students. We want to make sure that we're all on the same page. What is our shared vision or mission that really guides us in terms of the kind of work that we do? Make sure that all of those individuals are, in the same boat, going in the same direction, if you will. And then that we also want to use data to prioritize our decision making. A lot of our districts are already doing work to support well-being of our young people. So what does that look like? And what kinds of complementary programs might we need to bring in to fill in those gaps to better support our students?
Find more information from Oakland Schools about programs and resources available here in Oakland County and beyond by visiting oakland.k12.mi.us, oakland.k12.mi.us for more information. We're joined by Christina Harvey, the health curriculum consultant at Oakland Schools, on today's edition of the Megacast. Christina, just another couple minutes with you today before we'll need to wrap things up and say goodbye. Anything else that we should know about these efforts that are being made by Oakland Schools and its partners to address mental health in the classroom and in our school systems, or anything else we haven't discussed yet today that would be important for our audience to consider?
Yeah, I just really want to reemphasize that this kind of work takes time. This is slow, steady work. It's going to take us years of building this kind of infrastructure and providing this support to our students to really impact their well being. And again, coming back to what you asked about earlier, all stakeholders need to be involved. So, not only all stakeholders within our buildings, but also that community. So, our families, community agencies, we really want them all to be a part of this work that we're doing.
And with just another minute left or so, Christina, I just want to follow up on that. As you mentioned, this taking time, just what sort of foundation is being built, or what more of that foundation really needs to be developed over that time to make these programs not just exist in our local schools, but be effective in these schools too?
Yeah, I think it really has to do with what we talked about when it came to funding, right? Getting the appropriate staffing in place so that way we can offer these programs and supports in effective ways without overwhelming individuals. And also making sure that we are using that data to make sure that we're coordinating the existing efforts and things that we're adding in place so they support and reinforce each other.
Big topic of interest in our school districts and beyond. Mental health in our daily lives certainly been something that's been brought to the forefront over the past few years and already having immense impact on our students and other areas of our society. Christina, thank you so much for joining us.
Thank you for having me.